price.
Are you living in pain? Is it joint pain or muscle pain? If so, stay tuned. Welcome to Living Pain Free with Dr. Marc Darrow from the Darrow Stem Cell Institute in West Los Angeles. This is the program that can give you effective solutions for the pain you've been living with. Dr. Darrow is a medical doctor, board certified in physical medicine and rehabilitation. He teaches about the use of prolotherapy, PRP, and stem cells. Today's program could open up a new life without pain for you. Now, here's Dr. Darrow with his co-host, Dr. Nita Valens.
Hi there, Dr. Darrow.
Hello, Nita Valens. How are you today?
I'm good. Few allergies, but I'll get through it. How about you?
All right. Yeah, I'm doing really well. Appreciate that.
That's great. So, we want our listeners to do well, don't we? And this show is called Living Pain Free. We talk about orthopedic pain or what we call musculoskeletal pain. So if you have that kind of pain, and that includes muscle pain, joint pain, tendon pain, ligament pain, disc pain, back and neck pain, knee and hip pain, arthritis pain, and on and on and on. Maybe you have stiff joints or dull legs. You don't know what they are. So call us right here in the studio at 866-870-5752. That's 866-870-5752. And when you phone today, you get Dr. Darrow's latest book for free, Stem Cell and Platelet Therapy, subtitled Regenerate, Don't Operate, with over 250 scientific studies. We are here Saturdays at 10, again at 1 p.m., and you can also get a lot of information off of Dr. Darrow's website, which is www.lastemcells.com. That's lastemcells.com. And you can email Dr. Darrow off of every page and see him performing the treatments on videos. How's that?
I'm cool with that. I love it. And I've got some questions here if you're ready to go, Anita.
Sure. Let's do it.
Okay. This one just came in this morning. And as you folks know who work with me already, I'm very quick on email and texts and phone calls. And to email me, all you have to do is go to my website, and every page on the website has a blank to send me emails. So I do emails all day and all night in between patients, and I talk to a lot of people every single day about their questions about how they can heal without surgery. So this person says, hip replacement. I am 70 and losing mobility due to arthritis in my right hip. I'm in pain and have been told I need a hip replacement. Will this therapy help me? The therapy meaning using platelets and stem cells. Well, that all depends, like everything else in medicine, on where you're at with the arthritis. If your hip is fused, meaning that the leg doesn't move, that's going to be a problem. And there's not much I can do about that. If you've got some range of motion, we can sometimes increase the range of motion and get rid of the pain or decrease the pain. And if it's a very bad case, we'd probably want to use your bone marrow, which is a way of taking stem cells from the back of the pelvis. And with the stem cells come the platelets, and they're mixed together in the bone marrow. So that's a very quick procedure. It literally takes me about, I'd say about 15 seconds once we have the area numbed up to do the procedure. So it's not a big deal. It's not like the bone marrow aspirations that you've heard about when people have cancer, which is a painful process. The way I do it is not. It's a very small amount of bone marrow that's needed, and I can do it slowly so there's no what I'll call suction pain. So yes, we can probably keep you from getting a hip replacement, and this procedure works really all over the body. I inject everywhere from the back of the head when people have headaches to the neck with neck pain, shoulders, low back, mid back, you name it, hips, knees, toes, fingers, elbows, I'm jumping around there. Bottom of the feet, plantar fasciitis. A lot of people come in with arthritis in their hands, and sports injuries all over the body, meniscal tears, rotator cuff tears. So it's pretty much everywhere in the body that I do inject. I don't treat disease, and I'm not considering arthritis to be a disease, but a lot of people come in or they write me and say they've got multiple sclerosis, that they're going blind, or they've got diabetes. Can I help them with stem cells? The answer is no. If you do have diabetes, we can often get rid of it, though, but that's by cutting out carbohydrates, depending on the type of diabetes that you have. If you're overweight, Nita, you must have something you need to say, like there's a caller.
That's right. You read my mind. You're so
no,
good.
When I hear you breathe hard, I know that Susan is waiting.
That's right.
Susan, this is Dr. Marc Darrow. Thank you for calling very much. And I understand that one of your knees bothers you. Which one is it?
My left knee.
Okay. And how long has it bothered you for?
About 3 months.
What happened? Did you fall down, or did you start working out too much, or what is it?
When I walk and when I exercise, there's no pain, but about a dozen times a day, the knee, I'll just twist and the knee will pop, and it's quite painful when it pops.
Okay. So the popping in the knee generally is when the patella, which is the round bone in the front, becomes loose. And it's a very common syndrome, more in women who are younger when they start getting their periods, like soccer players and all that, because the extra estrogen loosens up the retinaculum, which is like a glove around the knee, and then that patella can slip out of place. The place that it slips out of is called the trochlear groove. You can look up these terms on Google if you like. And when that happens, there's a popping sensation. That's called a subluxation. It means a miniature dislocation. If there's a full dislocation, that patella can pop out to the side and actually get stuck. And some people will take their fist and pop it back in, or straighten their leg and pop it back in. But the best way to heal it is to use platelets and stem cells around that patella bone to thicken up the retinaculum, the tissue that holds it in place. Now, believe it or not, I have had that syndrome, and it happened to me when Dakota, my 80-pound husky, ran into my knee from the lateral side, the outside, when we were at the dog park together. I didn't see him coming, and he ran right into my knee and dislodged the patella, and that was a very painful process. And when I would walk around or stand up, it would catch, and I finally injected myself, and I used platelets and stem cells and healed it right up. I have no problem with that knee anymore. I run on it, I play golf with it, I exercise with it, and I am perfect. So from what you're telling me, I'm not sure until I examine the area, but it seems, Susan, like you have some patellar laxity. Okay, laxity meaning looseness, and it's something we can heal. I do those every day of the week. I treat probably more knees than any other part of the body, and I think you would have good success with regenerative medicine using platelets and or stem cells. It usually takes, with a syndrome like that, just 1 or 2 treatments to heal it up and tighten up that patella. Do you have any other questions about it?
Yeah, how do you know where to inject if it's the patella area? How do you know where to do the injection?
Well, we'd probably want to go inside the knee. I use an ultrasound, which is a diagnostic ultrasound. I can look inside with it. You may have fluid in the knee. If you did, I would aspirate out every drop of it. and I would go into the capsule of the knee, which is done away from the bones so we don't scrape the cartilage like most doctors do. And we'd put some platelets or stem cells or both inside the knee, and then we would go around the bone. So I can do that by palpation, meaning touching it. I can feel where the bone ends and the retinaculum begins. And typically, if that is the issue, we're going to inject every centimeter or so around the patella. Make sense?
And my other question was, I exercise most days, but I notice if I don't exercise for a day or two, the popping will stop. So is exercising making this problem worse?
It's not that it's making it worse quickly, but over time it could be making it worse. And this is a common syndrome that over-exercisers have. People who run too much, there's people that jump boxes. Do you know what that is? They have a box in front of them. Things like that can loosen up the retinaculum, and then the patella becomes loose and can get caught. So yeah, exercising can be a problem until you tighten it up. But a lot of people have loose knees because they don't exercise and the muscles are weak. So until I would examine it and touch it with my hands and move you around, I don't know what category you are in. If you do want to come into the office, there are people waiting at the office by the phone, and the phone number to the office, if you want to call, is 800-300-9300. I'll repeat that for people just tuning into the radio show. The office number is 800-300-9300. You can also watch me do injections on videos if you go to my website, which is www.lastemcells.com. I'll repeat that, www.lastemcells.com. And you can actually watch me do these procedures on the website. They're very quick and easy. You come into the office, you get injected, and you walk out. Okay? Any other questions?
Thank you very much.
Susan?
You answered all my questions. You've been very helpful. Thank you very much.
Good. And people that have what you have, I can't say everyone that I've treated is healed, but most people do. The reason I say I can't say if everyone has, because if someone doesn't come back to the office, we don't know if it's because they didn't get better and they don't want to see me again, or if because they got better and they don't need me again.
And for this kind of problem, you said typically a couple of injections should take care of it?
Usually, yeah. Usually a couple of injections. Sometimes one. Sometimes, no matter what I do, it's not going to fix it. And the biggest problem I have with patients is they cheat on me. And that means that I tell them, leave it alone, let the tissue grow before you go back and exercise or climbing stairs or jumping boxes. And some people just won't listen. I had one gentleman come in with severe arthritis in both his knees, and I did stem cells one time. He came back 2 weeks later, and he said it didn't work. He still had pain. And I knew he was a golfer, and I said, did you play golf? And he said, no. And his wife was sitting there rolling her eyes and said, come on, give the doctor a break, honey. You played golf 3 times. So if you don't want to listen to me, that's fine, but you're not going to get the results that I know how to give you.
Thank
it's
you
like
very
anything
much.
else. It's like anything else in the body. You got to give things time to heal. I don't care what it is.
Patience.
Patience. That's right. And I have some patients that aren't patients. And guess who one of them is? Me. To be honest with you, I've injected myself and gone out and done sports the same day because I'm an impatient patient.
Thanks again.
Thank you for your call, Susan.
Bye.
Bye-bye. Our number is 866-870-5752 right here at the station. Call and speak to Dr. Darrow. I have lines open for you. Check out the website at www.lastemcells.com. That's www.lastemcells.com. And you can see videos of Dr. Darrow performing the treatments on that website and email him off of every page on the site. And remember, most importantly, you get a free book when you call the program today. Stem Cell and Platelet Therapy, Regenerate, Don't Operate, Dr. Darrow's latest book with actually 264 studies. How about that?
I think it's cool. It took me 5 years to put this book together.
Well, it's got a lot of research.
It does, and I hope you will call in and talk to me on the station right now, and we'll send you out a free copy of the book. And I think you'll love it. You can get it. If you need more than one copy, that's fine. I'll give them to you. If you need an extra copy to give to your doctor, I'll give that to you. These studies not only show how to heal the body, but why not to get surgery? And what are the reasons? It's pretty simple. Most surgeries that are done in orthopedics for people that are at least walking around don't need to be done. Obviously, if you have a broken bone, yeah, you need to have surgery, have it put back together. But most of the surgeries, and the studies show this in the book, should not be done. People come out worse, and there are fake studies that are done. We have studies on that show that if you have a fake surgery or you have a real surgery, your long-term results are the same. That means that you can have a surgery and come out worse. So why do that? I have way too many new patients come in who have had what we call a failed surgery. They went in with all the good intentions. The surgeon had all the good intentions. The surgeons are great guys. It's not easy doing surgery. I take my hat off to them. I'm wearing a hat in front of the video to get ready to go play golf, Nita.
Yay.
But, yay. So, I did have a surgery on my shoulder. While I was in medical school, I was very enamored with becoming an orthopedic surgeon. And when I hurt my shoulder doing bodybuilding at the time, I stretched my hands too wide, and I was doing bench presses and stretched out the subscapularis tendon. And dummy me, I didn't know better. I went to my boss, who was an orthopedic surgeon, and he didn't know about regenerative medicine of stem cells and platelets, and he operated on me. My shoulder blew up like a balloon full of fluid. I had a high fever afterwards, and then I had a couple of years of misery. I then found out about regenerative medicine. I injected my own shoulder. I woke up the very next morning 100% completely healed, pain-free, full range of motion. And at that point, I knew this was the work that I was going to do on patients. So it's an amazing thing, and I can't tell you how many people that have come to me ready for a surgery who never had to do it. Here's the story of one of them.
Well, Hope, before you tell that story, do you want to pick up Lena in Sun Valley?
Absolutely. Lena, Dr. Marc Darrow, I understand that your son has a meniscus tear in his... Yeah, can you hear me, Lena?
Yes, I can. Thank you, doctor, for talking to me.
Okay. Are you from New York?
Yes.
You sound so cute with that accent. So your son has a meniscal tear. How old is he?
And I had a few more other questions because I've been listening to many years to you on the radio.
Beautiful. Let's deal with your son's meniscal tear first. How old is he?
Taking care of it. My adult son.
How old is your son?
He's 42.
Okay. And how long has he had knee pain?
Well, it's something to do with his whole. He does all kinds of exercises, and I was just wondering, maybe one day he'll come to see you. You know.
Well, I hope so. I'd love to see him. But the question is, how long has his knee bothered him for?
Oh, about maybe 4 or 5 years.
Okay. And did he get an MRI to show that he had a meniscal tear?
Something like he did get something like that.
Okay, well, an X-ray wouldn't show a meniscal tear, so most likely it was an MRI. So here's the catch-22. Most athletes have meniscal tears without pain.
I see.
So the fact that he has a meniscal tear doesn't mean that's where the pain is coming from.
Right.
Meniscal tear is just overuse of a knee in most cases. There are some that are giant meniscal tears, let's say bucket handle tears, where the knee doesn't move because the meniscus, which is like a pancake in between the bones to cushion the bones, is so beaten up that the knee doesn't move. That person probably needs a surgery, but most meniscal tears should not be operated on. It destabilizes the knee. So let me have a little talk here, Lena, so I can explain this to you, please. So I had pretty severe knee pain when I was walking golf courses during the COVID period, and I play at a place called Mountain Gate. And you can imagine what it looks like. It's in the mountains, and it is up and down. There's no flat lies at all. So I was pushing a golf cart through this kukua grass, which is hard to get through, and my knee was hurting more and more each weekend, and I finally couldn't even push the cart or walk. So I drove down to my office, and I looked with my ultrasound. I can look into my knee or anyone's knees or whatever body part, and I saw a bunch of fluid. And I aspirated out 35 Cs of fluid, and I put in stem cells. I did that procedure 4 times in 1 week, and my knee was healed. I noted a meniscal tear, and I injected that, and I have no more problems. So I am the living example of regenerative medicine, stem cells, and platelets of how this stuff works. I've used it on both my knees, both my elbows, my right wrist. I've had other people inject my neck all the way down to my pelvis, and I've had great success every time I have done it. So I don't want to make this out like it's the Holy Grail. It's not going to work on everybody, but it works on most people. So I'm totally behind it. I've dedicated my life to regenerative medicine. I've been told when I go to national meetings that I do the most of anybody on the planet. I don't know if that's true, but I work, basically I work 7 days a week. I inject 5 days a week every day, and I love the work I do because it's not work. It is so amazing to help somebody heal. And people say, "You're so amazing. What a great doc." It's not me. It's the regenerative medicine. It just works. And there is a flurry of doctors being trained in this. Orthopedic surgeons are doing this now. Why? Because it's so simple. It's so easy, and it works in most cases much better than surgery. So why do a surgery if you can just come in the office, walk in, get injected, and walk out? It makes no sense to me. Yes, you have to get surgery sometimes, but it's rare compared to the number of times that it doesn't have to be done, and it is done. There is a diagnosis called failed back syndrome, failed shoulder syndrome. Failed. That means a surgery was done and it came out bad. So again, I am not putting down surgeons. I love them. They do the hardest work in medicine. There's a lot of bad side effects that come up. People get infections. Sometimes with joint replacements, let's say a hip, one leg can be longer than the other. When you're finished, then what happens? Then you end up with back pain. So I'm very cautious about sending people to have surgery. I honestly can't remember the last time I did. I will in cases where someone has a completely locked joint, someone, let's say, who has been a dancer for 50 years and their hip joint is just gone, where there is nothing left. Anyway, stick with us, folks. We have another half hour coming up after the break.
Okay, hang on, Lena. We'll come right back to you. Thank you, Dr. Darrow. You're listening to Living Pain Free. Grab a pen or a pencil. Write down this important information coming your way. I'm your host, Nita Valens, and we'll be right back after these messages.
You're listening to Living Pain Free with Dr. Marc Darrow. Dr. Darrow's practice is located at the Darrow Stem Cell Institute in West Los Angeles. To schedule an appointment, call 1-800-300-9300. That's 1-800-300-9300. Dr. Darrow will be back in just a moment. Stay tuned.